In Malaysia, stroke is the third leading cause of death. According to the latest WHO data published in 2020, stroke death in Malaysia reached 21,592, or 12.85% of total death. The age-adjusted death rate is 81.65 per 100,000 of population, ranks Malaysia 92 in the world. It can affect anyone at any age.
Strokes can happen to anyone at any age. It's important to know the signs. Have you ever heard about the acronym FAST? F stands for face drooping, A stands for arm weakness, S stands for speech difficulty, and T stands for time to call emergency service.
Betul. For the past few days, I have experienced partial paralysis of my face when I do my work. I also have problems with my movement or walking.
Sounds like you suffered PIA, which is we call as a transient ischemic attack. It is a minor of symptom of a stroke. With this symptom occur often.
I experienced this system when I stressed, when I was tired at work.
What is a stroke, doctor?
Well, it is when the blood flow to a part of your brain gets stopped and slow down.
So the brain cells that don't get enough of oxygen and nutrient, the brain cells can start dying off really quickly, like within a minute. It is a serious emergency that need quickly treatment. If it is not treated fast, it can mess up the brain permanently or even lead to death.
So doctor, what can I do about this disease?
Well, first you need to rehab. After the main treatment, you will need a therapy to help you get back skills you lost and learn new one. It is like physical therapy, help with tasks, speech therapy, and someone to talk to like your parent or counselor that near to you. If the sickness is really bad, you might have to stay in the hospital for a while. They will keep an eye on you and give you medicine to help you with the symptom. Stop any problem like blood clot or infection, and keep things like high blood pressure and high cholesterol under control.
Thank you, doctor.
Stroke is an emergency. Every minute counts. We all know someone who had a stroke and is now left with a permanent disability. This could have been prevented if stroke treatment was given early. If you think someone is having a stroke, get them to the nearest hospital that can treat acute stroke straight away.
Alright, let's talk about some exercises that can be beneficial for stroke survivors to perform at home. It's important to note that the type and intensity of these exercises should be individualized based on the severity of the stroke and the specific needs of each survivor. First, flexibility exercises are a great place to start. These can help improve range of motion and reduce stiffness in muscles and joints. Simple stretches for the arms, legs, and neck can be effective. Remember to move gently and slowly, never forcing any movement beyond your comfort level. Next, we have strengthening exercises. These are essential for rebuilding muscle strength that may have been weakened due to the stroke. You can use resistance bands, light weights, or even your own body weight for exercises like leg lifts, arm curls, and chest squats. Start with a manageable resistance and gradually increase as you get stronger. Balance exercises are crucial for preventing falls and improving stability. Standing on one leg, walking heel to toe, or practicing standing up from a seated position are all great exercises to improve balance. Make sure to have a steady surface or chair nearby for support if needed. Functional task training involves practicing everyday activities to improve independence and confidence. This could include activities like reaching for objects, dressing oneself, or practicing getting in and out of bed. Focus on breaking down each task into smaller, manageable steps and gradually increase the difficulty as you progress. Finally, we have aerobic exercises, which are important for improving cardiovascular health and endurance. Activities like walking, cycling, or swimming are great options. Start with short bouts of activity and gradually increase the duration and intensity as tolerated. Remember, it's essential to listen to your body and work at your own pace. If you experience any pain or discomfort, stop exercise and consult with your healthcare provider. With consistency and dedication, these exercises can help improve physical function and enhance overall quality of life for stroke survivors.